Before we start, make sure to wash your hand before touching the patient during the palpation. So after washing your hand, make sure to use gloves for your safeness. So for today's activity, we will going to palpate a mastoid process which is for bony palpation and sternocleidomastoid for the muscle palpation. Now let's begin to the bony palpation which is the mastoid process. So hello, I am Honey Grace Domingo, your physical therapy for today. So I just want to inform you po that during the palpation process is hahawakan ko po kayo. So ngayon pa lang ho, naghihingi na po ako ng permission para ho gawin yan. Okay lang po ba? But you can freely say it po if you feel pain or discomfort during the palpation, okay? Okay. So now let's begin the palpation of the mastoid process. To palpate the mastoid process, the patient should do a sitting position, and in order to palpate it easily, the patient should rotate their head sideward and slightly turn their head away. So I'm going to ask permission po ulit na if pwede po is-side nyo po yung head nyo papunta dito. Yan. Okay lang po ba? Yan. Rotate your head sa side na to. Yan. So now that we rotate the head, yan, nakaside na ho yung head. So we will start palpating po the mastoid process. So you can start palpating it by lateral to the superior nuchal notch. So ito po yung superior nuchal line. Here. Sa baba po siya ng temporal bone natin. So, ayan. Again, mag-a-ask po ako ng permission nyo na hawakan ko na ho kayo, ha? Okay lang po. Ayan. So, here your superior nuchal line. So, ayan. Here. Mag-start tayo here para magpunta sa mastoid process. Ayan. Start na ho tayo, ha? So, here is your mastoid process. Yan. Yung makikita nating bone or yung unang bone na makakapa natin posteriorly to the earlobes. Yan po, ito po. And it's palpable because it's easily bone landmark na mahanap natin sa likod ng ating earlobes. May-feel nyo siya here. Itong bone na nakaumbok sa likod ng tenga natin. So again, this is your mastoid process. Right here. One of the muscle attached to your mastoid process is the sternocleidomastoid, wherein we will going to palpate it for the muscle palpation. For the muscle palpation, we have the sternocleidomastoid. Again, it is a sitting position. So in order to palpate that easily, the patient should rotate their head and neck on the opposite side and slightly flex it on the same side. So again, I'm going to ask your permission po para magawa po natin yun is hahawakan ko ulit kayo and gagawin po natin yung mga position na need. Okay lang po ba? So again, yes. So gagawin po natin is the head and neck, rotate on the opposite side, and slightly flex on the same side. So yan. So yan. So now, I'm going to ask permission po. Mag-start na po ako for the palpation. So okay lang po ba if hawakan po kayo around here? So yan. So we were going to start the palpation. So the sternocleidomastoid is you can found here. Ito po yung sternocleidomastoid natin. Yung prominent muscle na makikita mo dito. Yan. Yan, itong nasa gitna. Connected to the jugular notch to the mastoid process. Yan. As we can see, ito po yung parang medyo nakaumbok din siya. Yan, prominent po siya. Na makikita nyo. So this is your sternocleidomastoid process. The muscle action here, the main muscle action here is rotation of the head on the opposite side. Yan, as we can see, naka-opposite side. And flexion of the neck. On the same side siya. Yan. Yan, ito po yung sternocleidomastoid process. After the bony palpation and the muscle palpation, may na-feel po ba kayong discomfort and pain? Wala naman po. Okay, so ano naman pong na-feel nyo during the palpation? Okay naman po ba? Wala pong masakit sa inyo ngayon? Okay, so yun lang po. Thank you so much and have a nice day. So after the palpation, make sure to dispose your gloves and wash your hand thoroughly. Again, I'm Honey Grace Domingo from BSPT 1B.